Now let's discuss the topic of shoulder joint. So when I am talking about shoulder joint, I will discuss the shoulder joint in much more detail. It's a very important joint of the upper limb, and also I will discuss the other joint. So mainly the type of joint that is important for you to know. So if I am going to cover up the shoulder joint, I would also like to tell you what are the subheading in which I will cover up the joint. So we have got following subheadings: the type, the articular surfaces, ligaments, bursas, relations, factors maintaining the stability, arterial supply, the nerve supply, and also the movements of the joint. Other than that, we will also discuss the applied anatomy. Okay. So let's start with the type and articulation of the joint. So I would like to show you a diagram where you can appreciate the type of joint and what is the articular surfaces. So here you can see in this diagram, you can clearly see the glenoid fossa. So in this diagram, you can appreciate that this glenoid fossa is shallow. So it's not very much concave and it is shallow. As you can see in the diagram, this is a shallow glenoid fossa. So if I want to highlight this, you can see it is having a shallow concavity. It is not too concave in respect to the head of humerus. So that means when I am talking about shoulder joint, it's a joint that is not quite stable, but it's a freely mobile joint. So it's a multi-axial joint, and it is one of the most mobile joint in our body. It's a ball and socket type of synovial joint, but its mobility is at the expense of its stability. Okay, so shoulder joint, it's a type of ball and socket variety of synovial joint. Here it's a quite mobile joint, and it's a multi-axial joint because the movement can occur in 3 planes, but it's not a very stable joint because you can see the glenoid cavity which is highlighted here is not very much deep or concave. In respect to the articular surface of the head, so head of the humerus has to articulate, and you can see head of humerus is quite spherical. It's not almost a round spherical, but it's an almost spherical shape. So it has to accumulate the head of the humerus, and for that the glenoid fossa is shallow. So I would also like to tell what are the stabilities, what are the other factors which help in the articulation of head of humerus in the glenoid fossa. So one of the attachment is the glenoid labrum, which is deepening the cavity. Glenoid cavity is deepened by the attachment of glenoid labrum. So let's talk about the ligaments. So I would like to tell you about the ligaments, which is maintaining the stability of the shoulder joint. So we can see the shoulder joint from outside, and one of the important structure which is visible here in this diagram, when you see the shoulder joint from outside, you can clearly appreciate the fibrous capsule. So here you can see this is the fibrous capsule. Okay, this fibrous capsule is a very important function of this fibrous capsule is giving stability to the shoulder joint. So actually it is important to know the attachment of fibrous capsule. So when I am talking about fibrous capsule, it is attached to the articular margin. It is attached to the articular margin of the joint and of the glenoid fossa beyond glenoid labrum, beyond the level of glenoid labrum, and it's attached to the articular margin of the joint. And when I am talking about its lateral attachment onto the humerus bone, it is attached to the anatomical neck. So it is attached onto the glenoid labrum, beyond the level of glenoid labrum on the articular margin, but onto the humerus bone. If you will see its attachment onto the humerus bone, it is attached onto the anatomical neck. So actually only on the inferior aspect, the attachment is not exactly on the anatomical neck, but it goes towards the surgical neck of the humerus bone. Actually at the inferior aspect it is 1.5 and sometimes 1.5 to 2 centimeters below the anatomical neck. So the weak point of the fibrous capsule of the shoulder joint is its inferior aspect, because on the inferior aspect it is not exactly attached onto the anatomical neck of the humerus bone, but it is attached onto it is going towards the surgical neck of humerus 1.5 centimeter below the anatomical neck. Okay, so only it is inferiorly weak. Now, when you see the joint cavity from inside, you can appreciate the fibrous capsule and you can appreciate an important ligament, that is glenohumeral ligament. Second most important ligament is glenohumeral ligament. Actually, inside the fibrous capsule, we have got the synovial membrane is there, and that synovial membrane secretes synovial cavity, which is required for the synovial fluid is secreted, which is required for the mobility of joint. Glenohumeral ligament, if I talk about glenohumeral ligament, it is having three parts. Superior glenohumeral ligament is there, and middle and inferior glenohumeral ligament is there. So this is the superior glenohumeral ligament, and this is the middle and inferior glenohumeral ligament. Actually, glenohumeral ligament can be visualized when we see the joint cavity from inside, and it is giving more of support or strength to the fibrous capsule anteriorly. So glenohumeral ligament is visualized once the joint cavity is opened up. Okay, once the joint cavity is opened up. We have got three glenohumeral ligaments, that is superior, middle and inferior glenohumeral ligament, and these three glenohumeral ligaments are increasing the strength of shoulder joint because it is giving strength to the fibrous capsule anteriorly. It is giving strength to the fibrous capsule as these ligaments are merging with the fibrous capsule from inside. Also in this diagram you can appreciate the attachment of glenoid labrum onto the periphery of the glenoid fossa. So glenoid labrum is deepening the cavity. So what is glenoid labrum made of? It is made of fibrocartilage and it is deepening the joint cavity. So please write down about glenoid labrum. Glenoid labrum is giving strength to the joint cavity, and it is made of fibrocartilage. It is an example of fibrocartilage, and it deepens the joint cavity of shoulder joint. That is glenoid fossa. It is deepening the glenoid fossa. Other than that, you can see long head of biceps brachii is intracapsular. It is lying inside the fibrous capsule of shoulder joint. So it is intracapsular, long head of biceps brachii. Okay, let's talk about few other ligaments. So this is another ligament where the glenohumeral ligament is shown very nicely from the interior aspect. We can appreciate this is the superior glenohumeral ligament giving strength to the fibrous capsule. Also we can appreciate here the middle glenohumeral ligament. This is the middle glenohumeral ligament, and lower to it we have got the inferior glenohumeral ligament. So these three, so this is inferior glenohumeral ligament, and this is the middle glenohumeral ligament. So these three glenohumeral ligament is giving the strength to the joint cavity and merging with the anterior aspect of fibrous capsule. In this diagram you can also appreciate this is the glenoid cavity, and the glenoid cavity on the periphery. If you will see the glenoid cavity on the periphery, it is having the attachment of glenoid labrum, and this glenoid labrum is giving more deepening, it is more deepening the glenoid fossa. Let's see other ligaments also and more of the diagram showing the glenoid labrum. So you can see here the glenoid cavity is, so if I enlarge this diagram you can clearly appreciate that there is glenoid labrum which is surrounding the glenoid fossa and deepening the glenoid fossa. Okay. Other than that, in this diagram also you can appreciate few of the bursas in relation to shoulder joint. So you can see there is subacromial bursa superiorly, below the acromial process and the coracoid process it lies. So this is the subacromial bursa. This is the outline of subacromial bursa. Also there is anteriorly subscapular bursa which lies between the subscapular muscle and the joint cavity, and we have got here infraspinatus bursa also. Here there is infraspinatus bursa also posterolaterally. So let's see more of the diagram which is showing the other ligaments. So here I want you to show few more ligaments, that is transverse humeral ligament, the coracohumeral ligament, and also coracoacromial ligament. So in this diagram, when I enlarge this image, when I am enlarging this image, you can see there is superiorly, you can see there is a ligament which is connecting two important structures. They are connecting coracoid process and that of acromial process. This is the coracoid process and this is the acromial process which is connected by this ligament, that is the coracoacromial ligament. So this coracoacromial ligament is preventing superior displacement of shoulder joint. It is preventing superior displacement of the shoulder joint, and it's a very important support which is given along with the coracoacromial ligament. The coracoid process and acromial process together is called as coracoacromial arch, which is preventing superior displacement of shoulder joint. We have also got the other ligament, that is coracohumeral ligament. See here, this is coracohumeral ligament which is connecting the coracoid process. It is attached to the coracoid process to the greater tubercle of the humerus. So this second ligament which I am highlighting here, this is the coracohumeral ligament connecting greater tubercle of humerus and the coracoid process. Also we can see transverse humeral ligament. Here in this diagram we can appreciate here, this is the transverse humeral ligament which is bridging the bicipital groove, and below it the tendon of biceps brachii muscle is passing. So these are accessory muscles of shoulder joint. So I would like to write few lines about these ligaments. So please write down. Coracohumeral ligament. When I talk about coracohumeral ligament is connecting coracoid process of scapula to greater tubercle of humerus, bone. Now, if I talk about coracoacromial ligament, the coracoacromial ligament is connecting coracoid process plus the acromial process of scapula. So actually these three structures together, that is the coracoacromial ligament, coracoid process and acromial process, is called as coracoacromial